So what is eczema and how is it different from psoriasis? Well, in very simplistic terms, to understand the disease, it is just an extension of dry skin. So eczema is just when the skin becomes too dry and is associated with a lot of itching, it may be eczema skin. Psoriasis, on the other hand, is a familial disease which is genetically driven, has an autoimmune component, and has a slightly different presentation, a little more symmetrical, very specific areas of distribution, and tends to run in families like I mentioned. But eventually both of them have a very similar patient presentation in the form of itching, dry skin, scaly, which gets aggravated in winter, and there are some triggers that can make it worse. So the treatment plan is also similar in terms of using hydration, making sure that the skin is not dry and not irritated. So eczemas and psoriasis both have their individual triggers, but some of them are quite obvious. As I mentioned, skin tends to be dry and itchy, so any condition that makes the skin drier can make the psoriasis or eczema worse. So one simple thing could be just a change in season. So in winter, you would expect that the eczema gets worse and the psoriasis gets worse. Of course, we all know that stress is something that makes everything worse. So being in a stressful situation may aggravate your psoriasis and eczema. Certain triggers most specific for psoriasis include medications, an infection in the system. Another very important trigger for psoriasis to worsen is consumption of alcohol and smoking. These are two things that one must avoid if you want to control your psoriasis. Let's talk about treatment. For psoriasis, there are specific treatments, but something that will help both psoriasis and eczema would be improving the quality of skin using the right moisturizer. So all moisturizers are not the same. Some will definitely help more than the others. You want to look for some things that have ceramides in them, more butters like cocoa butter, shea butter, can contain occlusive agents like glycerine. Something that everyone can use is coconut oil, and using some application about 15 to 20 minutes before you go in for a shower helps the coconut oil to seep into the skin, hydrate the skin, which you can wash off then during the shower, and follow that up with a moisturizer to seal in that humidity and make the skin nice and soft. Specific treatments would include applications which would be prescribed by your dermatologist, which could include corticosteroids, non-corticosteroid treatments, and in severe cases you must take the help of your dermatologist, who will start you on systemic treatment.